Hi, Jennifer. Welcome to our health center. My name is Dr. Smith, and I'm here to help you today. I understand that receiving a medical diagnosis can be a bit overwhelming, and I want to make sure we go through everything together, step by step. So, may I ask what specifically brings you here today?
Yes, doctor. I've recently received a diagnosis of deep vein thrombosis, but I must admit that I don't fully understand what it entails. I'm feeling quite anxious about it, and I came here today hoping to get a clearer understanding of what this means for my health and to learn more about the treatment options available to me.
You've absolutely come to the right place, Jennifer, and I want to assure you that we'll take all the time necessary to make sure you leave here with all your questions answered. Let me start by explaining what deep vein thrombosis, or DVT, actually means. Deep vein thrombosis occurs when a blood clot forms in one or more of the deep veins in your body, most commonly in the legs. This clot can obstruct blood flow, which might cause symptoms like leg pain, swelling, or even redness and warmth in the affected area. However, it's important to note that sometimes DVT can be asymptomatic, meaning you might not experience any noticeable symptoms at all.
I see. That does help clarify things a bit. But what are the potential risks if this condition is left untreated?
That's an excellent question, Jennifer, and I'm glad you're asking. The main concern with DVT is that the clot could potentially break loose and travel through your bloodstream to your lungs, causing what we call a pulmonary embolism. This is a serious condition that can be life-threatening if not treated promptly. Another risk, though less common, is that the clot could lead to long-term complications in the affected leg, such as chronic pain, swelling, and, in severe cases, skin ulcers. However, with the right treatment and lifestyle adjustments, we can significantly reduce the chances of these complications occurring. Does this make sense so far?
Yes, doctor. It's starting to make more sense now, though it's still a lot to take in. Does this mean that I'll have to start taking medication to prevent these risks?
I understand that this can feel like a lot to process all at once, and I'm here to help you navigate through it. Before we jump straight to medication, I want to discuss some non-pharmacological approaches that could be very effective in managing your condition. The first and most important step is incorporating regular physical activity into your daily routine, particularly walking. A daily 30-minute walk without interruptions is crucial because it helps promote good circulation and reduces the risk of the clot worsening. It's one of the most effective and simplest measures you can take to manage DVT.
Doctor, I appreciate the advice, but I'm feeling a bit overwhelmed. I've already made so many changes to my lifestyle after my heart attack 2 years ago and the cancer treatment last year. Quitting smoking and drinking was tough enough, and now adding regular exercise feels like yet another challenge I'm not sure I'm ready for. Wouldn't it be easier to just start medication instead of making more changes to my lifestyle?
Jennifer, I completely understand where you're coming from, and it's entirely normal to feel this way after all the adjustments you've already made in your life. It's clear that you've been through a lot, and the thought of yet another change can be daunting. However, I want to emphasize that the long-term benefits of walking regularly far outweigh the convenience of starting medication right away. While medication might seem like a quick fix, it often comes with side effects and could make you reliant on it for life. On the other hand, regular exercise, like walking, not only helps with DVT, but also improves your overall cardiovascular health, boosts your mood, and strengthens your immune system. Let's approach this gradually. Instead of jumping into a full 30-minute walk every day, how about we start with something more manageable? For the first week, try walking for just 5 minutes each day. In the second week, increase it to 10 minutes, and continue adding 5 minutes each week until you reach 30 minutes. This gradual approach will give your body time to adjust and make the change feel less overwhelming. Do you think this plan might work for you?
I think that sounds more manageable, doctor. Starting with just 5 minutes seems like something I can handle, and gradually building up from there doesn't seem too daunting.
I'm really glad to hear that, Jennifer. Starting with just a few minutes each day is a great way to ease into the routine, and it allows your body to adapt at a comfortable pace. Over time, you'll likely find that the daily walk becomes not just a task, but something you actually look forward to as a time to clear your mind and focus on your well-being. And remember, every step you take is a positive step toward improving your health and preventing future complications. I'm confident that you'll start noticing positive changes in how you feel within just a few weeks. Now, I'd like to schedule a follow-up appointment with you in a month to check on your progress and make any necessary adjustments to your treatment plan. We can discuss how you're feeling, and, if needed, we can explore medication options at that time. Does that sound like a good plan to you?
Yes, that sounds like a good plan, doctor. I feel more reassured now and less anxious about the whole situation. I'll do my best to stick with the walking routine and see how it goes.
I'm really pleased to hear that, Jennifer. You've made a wise decision today, and I'm here to support you every step of the way. If you have any questions or concerns as you start this new routine, please don't hesitate to reach out to me. Here's a pamphlet that explains more about deep vein thrombosis and the benefits of regular exercise. On the back, you'll find my contact information, so feel free to call me if anything comes up.
Thank you so much, Dr. Smith. I really appreciate your help and the time you've taken to explain everything to me.
It's my pleasure, Jennifer. Take care, and I look forward to seeing you again in a month. Keep up the good work, and remember that each small step you take brings you closer to better health.